Oxytetracycline. It is a short-acting tetracyclines. Oxytetracycline is one of the most commonly used tetracyclines in veterinary practice today. It was the second of the broad-spectrum tetracycline group of antibiotics to be discovered. It is obtained from the actinomycete Streptomyces rimosus. Oxytetracycline base occurs as a pale yellow to tan crystalline powder that is very slightly soluble in water and sparingly soluble in alcohol. Oxytetracycline HCl is readily soluble in alcohol. Commercially available oxytetracycline HCl injections are usually prepared in either propylene glycol or povidone-based products. Oxytetracycline is a broad-spectrum antibiotic with activity against bacteria, mycoplasma, spirochetes, chlamydia and rickettsiae. It shares the antibacterial spectrum and mechanism of action with other tetracyclines. Although it is a broad-spectrum antibiotic with activity against a wide variety of bacteria, but some strains of bacteria have now developed resistance to this antibiotic, which has reduced its effectiveness for treating certain types of infection. Oxytetracycline is readily absorbed after oral administration with bioavailability about 60–80%. After IM administration, its peak plasma levels may be achieved in 0.5 to 2 hours. The long-acting products are slowly absorbed, giving prolonged blood concentration. After absorption, it is widely distributed in body tissues and fluids, except in CSF and brain. Excretion of oxytetracycline is mainly as unchanged drug in urine and bile. It is also excreted in significant amount in milk. Elimination half-lives of oxytetracycline in different species are: dogs and cats 4 to 6 hours, cattle 4 to 10 hours, horses 8 to 10 hours, swine 6 to 7 hours and sheep 3.5 hours. Depot preparations may maintain plasma concentration for 72 to 96 hours. Oxytetracycline is widely used in veterinary species for treatment of various infections caused by susceptible organisms. Oxytetracycline is used to treat infections of the respiratory and urinary tracts, skin, ear and eye, although the use of tetracyclines for such purposes has declined in recent years due to large increases in bacterial resistance to this class of drugs. It is sometimes also used to treat spirochetal infection, clostridial wound infection and anthrax in patients sensitive to penicillin. The drug is particularly useful when penicillins and/or macrolides cannot be used due to allergy. The adverse effects, contraindications and drug interactions of oxytetracycline are similar to those discussed for the group. Oxytetracycline produces irritation on injection, so it is available also in combination with piroxicam, which alleviates pain associated with local irritation on parenteral administration. Long-acting depot preparations are also available and require less frequent repetition. The drug withdrawal and milk discard time for oxytetracycline in cattle and swine is 14 to 22 days and in poultry is 5 days. Dose dogs and cats 5 to 10 mg per kilogram, SC or IM, 1 to 2 times daily. 20 milligrams per kilogram, PO, 3 times daily. Cattle, sheep, goats and pigs, 5 to 10 milligrams per kilogram, IM or slow IV, once daily. 20 milligrams per kilogram, depot IM injection, repeated after 2 to 4 days. Calves, foals, lambs and piglets 10 to 20 milligrams per kilogram, IM or IV, once daily. Horses 5 milligrams per kilogram, slow IV, 1 to 2 times daily. Poultry 10 to 25 g, 100 liters drinking water. Mechanism of action: tetracyclines inhibit bacterial protein synthesis and are primarily bacteriostatic. In a way somewhat similar to aminoglycosides, the action of tetracyclines can be divided into two processes: passage of tetracyclines into bacterial cell and interaction of tetracyclines with bacterial ribosomes. A. Passage of tetracyclines into bacterial cell. Tetracyclines enter gram-negative bacteria by two transport mechanisms, in part by a passive process and in part by an active process. The first is passive diffusion through the hydrophilic channels formed by the porin proteins in outer cell membrane. The more lipid-soluble members, e.g. doxycycline and minocycline, pass directly through the lipid bilayer by passive diffusion. The second mechanism involves an energy-dependent active transport system that pumps all tetracyclines across cytoplasmic membrane. Although passage of tetracyclines into gram-positive bacteria is less well understood, it requires an energy-dependent carrier transport mechanism. B. Interaction of tetracyclines with bacterial ribosomes. Once the tetracyclines gain access to bacterial cell, they bind to the 30S ribosomal subunit. They prevent binding access of aminoacyl tRNA to the acceptor A site on the mRNA ribosome complex. This prevents addition of amino acids to the growing peptide chain, resulting in inhibition of protein synthesis. Tetracyclines are highly effective against multiplying microorganisms and are more active at pH 6 to 6.5. Effects of tetracyclines are mostly reversible, as the bacterial protein synthesis is restored when the drug is removed. Therefore, a responsive host defense system is essentially required to remove static bacteria. Although the tetracyclines are primarily bacteriostatic, at high concentrations, they tend to become bactericidal because at high concentrations they appear to affect the functional integrity of bacterial cell membranes as well. At high concentrations, they also tend to impair protein synthesis in host cells by binding to the eukaryotic 40S ribosomal subunit. However, penetration of tetracyclines in eukaryotic cells through cell membrane is poor due to lacking of specific carrier transport system. Moreover, the mammalian protein synthesizing apparatus is less sensitive to tetracyclines. Microbial resistance to tetracyclines develops slowly in a graded manner. Microbial resistance to tetracyclines may be acquired by at least 3 mechanisms: decreased penetration into cells, enzymatic inactivation, and ribosomal protection. The most important mechanism is decreased penetration of the drug into previously sensitive microorganisms. This may occur either due to decreased antibiotic influx into bacterial cell due to development of less efficient transport mechanisms or due to an energy-dependent efflux of antibiotic from bacterial cell by a modified protein carrier. The enzymatic inactivation of tetracyclines and production of proteins by microorganisms which protect ribosomes by binding with tetracyclines are other 2 lesser important mechanisms of acquiring resistance. Resistance to tetracyclines is primarily plasmid-mediated and can be transmitted through transduction or conjugation. Microorganisms those have become resistant to one tetracycline are usually resistant to other members of the group cross-resistance. However, some organisms not responding to other tetracyclines may be inhibited by minocycline. A partial cross-resistance between tetracyclines and chloramphenicol has been noted in some microorganisms. Pharmacokinetics. Absorption. The oral absorption of tetracyclines is variable, with older drugs being less bioavailable and newer lipid-soluble. Tetracyclines, e.g. minocycline and doxycycline, being 100% bioavailable. Absorption of tetracyclines from GI tract is decreased in presence of polyvalent cations, which are present in food and milk products. All tetracyclines produce varying degree of tissue irritation on parenteral administration, especially chlortetracycline. Therefore, for parenteral administration, buffered solutions are prepared. Procaine is added to tetracycline solution for IM administration in case of small animals. Distribution. Tetracyclines bind to plasma proteins to varying degrees and are widely distributed in most tissues including kidneys, liver, lungs, bile and bones. However, with exception of lipid-soluble members, example, doxycycline and minocycline, tetracyclines do not penetrate the brain and CSF. Tetracyclines are stored in the reticuloendothelial cells of liver, spleen and bone marrow. They are also incorporated into forming bone and enamel and dentin of unerupted teeth, possibly because of their binding action with Ca++. Tetracyclines cross the placenta and enter fetal circulation and amniotic fluid, biotransformation and excretion. With exception of lipid-soluble tetracyclines, the tetracycline antibiotics are not metabolized to a significant extent in the body. Most tetracyclines are excreted in urine 60% via glomerular filtration pathway and in feces 40% via biliary excretion. Tetracyclines undergo enterohepatic circulation, which may affect their duration of action. Side effects. Adverse effects. The tetracyclines have a relatively low toxicity at normal dosage levels. However, a number of side effects have been associated with tetracyclines. Side effects may be worsened in animals with renal disease due to decreased elimination of the drug. Gastrointestinal upsets. All tetracyclines produce GL irritation to varying degree in some patients, particularly after oral administration. Anorexia, abdominal pain, diarrhea, and nausea and vomiting in small animals may occur. Superinfection by non-susceptible pathogens such as fungi, yeast and resistant bacteria is a possibility, which if occurs may lead to disturbances in the intestinal function with candidiasis, enterocolitis or pseudomembranous colitis. The oral administration of tetracyclines may lead to fatal diarrhea in horses and indigestion due to deleterious effect on rumen microbes in ruminants. Effect on bones, teeth. Tetracyclines are deposited in growing teeth and bones due to their chelating properties with calcium. They form tetracycline calcium orthophosphate complex, which inhibits calcification, e.g. hypoplastic dental enamel, and results in permanent discoloration, first yellowish then brownish, of the teeth. The stained and hypoplastic teeth are more prone to various degenerations. High concentrations of tetracyclines can interfere with the calcium deposition in bones and delay fracture healing. Given during pregnancy or in neonates, tetracyclines may cause temporary suppression of bone growth. Hepatotoxicity. Tetracyclines in excessive doses can produce fatty infiltration of liver. Hepatotoxicity with jaundice due to large doses of tetracyclines has been reported in pregnant women and in some animals. Nephrotoxicity. Tetracyclines are potentially nephrotoxic, particularly in renal insufficiency. They may impair urinary concentrating ability in patients even with normal renal function. The administration of expired tetracycline products may lead to acute tubular nephrosis in animals. The inhibition of mammalian protein synthesis has catabolic effect resulting in increase in the blood urea nitrogen levels. Hypersensitivity reactions. Hypersensitivity reactions are not common with tetracyclines. Rarely, they may produce skin rashes, urticaria, pruritus and exfoliative dermatitis. Angioedema and anaphylaxis are extremely rare. Complete cross-sensitization is exhibited by tetracyclines. Minocycline may be more likely to cause allergic drug reactions. Cardiovascular effects. The rapid intravenous administration of tetracyclines may result in hypotension, collapse and sudden death in animals. This has been related to rapid chelation of blood calcium, although a depressant effect by propylene glycol carrier itself may also be involved. Pre-treatment with calcium borogluconate and slow rate of IV infusion prevent these unwanted effects. Other effects. Tetracyclines cause irritation on parenteral administration. swelling, necrosis and yellow discoloration usually occur at injection site. The tetracyclines inhibit WBC chemotaxis and phagocytosis at injection sites, particularly when present in high concentrations. Tetracyclines may prolong blood coagulation either directly by chelating calcium or indirectly by depressing prothrombin synthesis due to depression of vitamin K by bacterial flora. Other adverse effects caused by tetracyclines include drug fever in cats, photoallergic dermatitis in humans, and anti-anabolic effect in many species. Contraindications and precautions. Tetracyclines are contraindicated in hepatic insufficiency, renal diseases, and in patients those are hypersensitive to them. Oral administration of tetracyclines to ruminants and horses is not recommended because they inhibit the normal bacterial fermentation of plant fibers. They should not be used in the last 2 to 3 months of gestation in pregnant animals and up to 4 weeks in neonates. Tetracycline preparations should never be used beyond their expiry date because they cause damage to the proximal renal tubule due to the formation of a degradation product, ANHYDRO4 epitetracycline, causing Fanconi syndrome. In Fanconi syndrome, glucose, amino acids, uric acid, phosphate and bicarbonate are passed into the urine, instead of being reabsorbed. Tetracyclines should never be administered with food, milk and milk products because they bind with food particles and also easily with magnesium, aluminium, iron and calcium in food and milk products, thereby forming insoluble complexes, which reduce the absorption ability of tetracyclines. Therefore, oral tetracyclines are generally given at least 1 to 2 hours before or after food and milk or any cation-containing product. Partial exceptions to these rules occur for doxycycline and minocycline, which may be taken with food, though not iron, antacids, or calcium supplements. Tetracyclines should not be given intrathecally. Drug interactions. Antacids, iron preparations, saline purgatives, kaolin, pectin and sodium bicarbonate decrease the absorption of tetracyclines from GI tract. Concurrent administration of nephrotoxic drugs like methoxyflurane may hasten renal damage. Tetracyclines may interfere with bactericidal activity of penicillins, cephalosporins and aminoglycosides. Concurrent use of tetracyclines and oral anticoagulants may aggravate bleeding by depressing plasma prothrombin activity. Microsomal enzyme inducers like phenobarbital and phenytoin may decrease the plasma half-lives of lipid-soluble tetracyclines, e.g. doxycycline and minocycline, by hastening their metabolism. Tetracyclines should not be administered mixed with IV fluids, particularly ringer lactate and calcium preparations. Clinical uses. Tetracyclines are used in the treatment of infections of varied pathogens like bacteria, mycoplasma, chlamydia and rickettsiae, anaplasma, hemobartonella, Ehrlichia and Borrelia. In birds, They are used in the treatment of psittacosis. Various infections treated by tetracyclines include bronchopneumonia, urinary tract infections, metritis, mastitis, prostatitis, cholangitis and pyodermatitis. Actinomycosis and actinobacillosis also respond to tetracyclines. Some agents, e.g. chlortetracycline, have been used in food-producing animals as growth promoters. As tetracyclines have high affinity for bones and get deposited in them, they are occasionally used as markers of bone tumors. Although tetracyclines are broad-spectrum antibiotics, the acquired resistance is now widely prevalent among bacteria. Therefore, they should only be used for those infections for which a more selective and less toxic antimicrobial is not available. Administration: tetracyclines may be administered by oral, parenteral, topical or intramammary route. The choice of route of administration depends on the species involved, type of action desired and compound to be used. All tetracyclines can be administered by IV or IM route, but the IM route is not recommended for drugs which cause excessive tissue irritation. Local application of tetracyclines in ophthalmic ointments or buffered solutions is employed for conjunctivitis. Intramammary infusion of tetracyclines for the treatment of mastitis in dairy animals is extensively used in veterinary medicine.